Hello, my name is Roland Cabiad. I graduated from nursing school in 1984 from the University of Mary Hardin-Baylor School of Nursing. My first job as a nurse was working at the Veterans Affairs Psychiatric Hospital in Waco, Texas as a new psychiatric nurse. The Waco Veterans Affairs Hospital in Waco, Texas housed approximately 1,200 mentally ill veterans. There I observed what war had done psychologically to these veterans from World War II, Korea, and Vietnam. They appeared normal on the outside, without any visible injuries, but when you looked into their eyes, you could see the hurt and pain. Even as a young nurse, I could see this. Coming from a military family, I could only hear this psychological trauma called shell shock from my parents. In my psychiatric nursing class, the psychiatric nursing instructor had described this mental illness as battle fatigue for the Vietnam-era veterans. In today's current war, the mental health community identifies this psychological trauma as post-traumatic stress disorder, or PTSD. The building I had worked in had 2 substance abuse units in which we treated about 80 to 100 alcohol and drug-dependent veterans. Many of the veterans would say, "I drink and use drugs to hide the pain." Many veterans stated that they had been married 3 or 4 times and how they could never find anyone who they could bond to in the civilian community. As a psychiatric nurse, I listened to many of their stories in which they described their nightmares. I believed them because I was working on night shift and I could hear some of them scream. In one of the support groups, I had one veteran who just started crying and screaming, "Why am I alive and my buddies are dead?" And another veteran in the group said, "You know that when I came back stateside, young people called me a baby killer and spit on me. What was sad was visiting day. When the family came to visit, I saw the despair and apprehensiveness in their wives' and children's eyes when they came to visit their fathers. But what was worse is when the children and wives left. The veteran would reflect with me about their visit with their families and in their disappointment about themselves. I remember one veteran saying this, 'I should not be here. I should have been a better provider and a better husband and a father.' Back then I could only listen to their stories and empathize with them, medicate them when they became anxious, hostile, and depressed, or comfort them by listening to them and not be judgmental. Knowing what I know now, I was practicing the way of knowing with my veterans as a young nurse. I was using aesthetic and personal knowing. Aesthetic knowing, as defined, which is when a nurse interprets the patient's behavior in regards to relationship and whole rather than separate discrete parts. Capers, 1978. Personal knowing is knowing how to be authentic with others, knowing one way of being with another person. It focused on how nurses come to know how to be authentic in relationship with patient. Fawcett, 2001. After 27 years of being a nurse, I have been using these theoretical principles of knowing.